Okay, hello and welcome to Fertility Network's new webinar series. We will be going live every month and covering a topic a different topic with a guest speaker based on lots of different topics, surrounding fertility and infertility. There is a question and answers box at the bottom of your screen where you can ask our guest speaker any questions and you'll get an answer. Your face is not seen, it's just myself and our guest speaker that will be seen, so don't worry about that. Our first guest speaker this week is going to be Fertility Network's Kat Strawbridge. As you know, she will be talking about the topic of fertility in the workplace. She will be giving a background to her story and the barriers that she's faced, and also talking about the charity's new aims in terms of fertility in the workplace. So I will pass you over to Kat and hope you enjoy our webinar.
So I'm Kat Strawbridge. As Megan said, I'm going to be talking today about fertility in the workplace. I am going to share my screen so that you have a presentation that you can see. And I'm going to put that down. So I'm going to talk you through this. If you do have questions, I can't see the Q&A box at the moment, so I won't be able to necessarily answer immediately. Perhaps, Megan, if questions come in, you could let me know. I'm going to cover a broad range of things. I'm not sure who's going to be watching this now live or later once we put it on YouTube. So I am going to cover some things that some of you may know already, but it's just so that we make sure that we reach as many people as possible. And hopefully, if you are a fertility patient, hearing some of the information and hearing my story and some of the stats that we've got from some of the research will help you realise that you're not alone and you're not the only person dealing with this. And if you are watching this and you are a manager or an HR person thinking about introducing fertility policies or working with someone who is going through fertility, I'm going to give you a bit of a background about fertility treatment and what it entails, just to give you a bit of an understanding. So this is going to be quite broad. There will be an opportunity definitely for questions at the end if I haven't answered something specific. You can all see my screen, so we're good. So what is the Fertility Network? It's got to be the place to start. We are the UK charity here to support men and women facing fertility issues. Some of you will know me because I work at the Fertility Network. Other people might know me because I'm on Instagram because I'm trying to conceive myself. But really, like, I work with the Fertility Network, not necessarily in this role, but I'm looking after this at the minute. What we want to do is we want to break the silence around infertility and help you realise that you're not alone. We offer free and impartial advice, and that's through a nurse line. So if you have an appointment, and this has happened to me, where you have a scan, you're feeling quite emotional about it, then you're thrown into a nurse's office to find out, how you give your meds. This definitely happened to me the first time. And then you leave the hospital or the clinic and you just don't know what to do. You can call Diane and ask her, and she will talk you through your injections. She will talk you through any questions that you have. She's just amazing. And then we have a free information line. So if you've got any funding questions, anything else, you can give our information line a call. We do have support in country, in Scotland, Northern Ireland, Wales and England, so it can be quite specific depending on where you are based. We have free online forums, and that's called Health Unlocked, where you can talk to each other privately and securely. You can receive messages and help from the nurse, and also we have some free counsellors in there as well. And the other thing we do, and if you're signed up to our e-news, which if you're not, please do sign up on our website. We campaign for equitable access for all. So we want everyone to have 3 rounds of IVF funded on the NHS. The 3 rounds is because the NICE guidelines recommend 3. So that's where that comes from. Some places you get it, other places you don't. We have a huge campaign launching on the 6th of September 2018, depending on when you're watching this. So if you're watching this live, make sure you get involved in that. So who am I? So I'm Kat. As I said, I work with the Fertility Network, but I'm also trying to conceive myself. And I have been trying to conceive for 6 years. I've got an unexplained diagnosis. You can see there that I've had several rounds of IVF, and unfortunately 2 of them resulted in pregnancies that I then later miscarried. I have got experience of working in an office where I didn't tell anyone that I was going through IVF. I was at a level where I could kind of duck in and out as much or as little as I needed to. But the fact that people didn't know, it still left me nervous, you know, when I was in the waiting room or when I was in a scan that someone might call. So, you know, even though I've done that and I've been there myself and I understand why, and in my case, it was because I didn't want to bring it to work. I wanted to have work as a distraction and to have, you know, some of my life was about fertility, but some of it it wasn't. So I understand why you might not want to, but it does lead inevitably, I would say, to worrying about it, you know, and kind of being nervous about missing work for appointments, etc. And obviously there are some days where you do need off. I have not worked because I left work, so I did a treatment without working, and now I'm working with the Fertility Network, who, as you can imagine, are fully supportive, which is amazing. So what is infertility and who does it affect? So it is a medical condition defined as a disease by the World Health Organization. Now, a lot of people don't necessarily realize that, but when you think about it like that, this is why we need policies. At the moment, we don't have laws, but we need the minimum policies, and that's something the Fertility Network is working to achieve. We do have some information about this on our website already. We're just looking to review that and expand that, and I'll talk a bit more about that a bit later on. It affects everyone, whether you're in a heterosexual couple, a same-sex couple, if you're single, this can affect anyone, and it affects male and female employees. So, and that's something that I think that often people don't realise, even though it's the female often that is going through, you know, the treatments and the scans. The male, if it's a heterosexual partnership, then, you know, they are so, you know, so fundamentally involved in this, emotionally, you know, supporting their other half. So that's something that workplaces often don't realise. They think about it as a female issue, but that isn't the case. As you possibly know as well, male factor infertility this year, according to the HFEA, is actually the most likely cause of infertility. So, you know, there's all of the emotional and psychological impact that has as well. So this is something we really need to help educate people about. The impact isn't just on the employee, it's on their friends, it's on their family, and it's on their work and their co-workers. Whether you try for that not to be the case or not, inevitably in some way or shape or form, it does unfortunately impact it. Fertility treatment. So if you're watching this from an HR or a manager point of view, you might not understand exactly what fertility treatment is. This is a very, very basic version. The first thing I want to say is that there is no one size fits all. Fertility treatment is so bespoke depending on who you are and how you're being treated. It can change from clinic to clinic as well. So that is first and foremost, I think, one of the things that people really struggle with when they are a fertility patient in telling their work. It's explaining how they're not sure how the process is going to go, but that is because we don't know necessarily. We have to take it day by day, and then as an employee, we can only tell you as much as we know. So that's really, really important if you are working or watching from a manager or a HR perspective. So you get your initial diagnosis after you've been trying to conceive for over a year. You go to your GP, they do run some tests, and then they will refer you for some alternative tests. If you get then referred to your fertility clinic, or sometimes I think GPs might be able to do this, you might have less invasive treatment, i.e. IUI or Clomid, and it's to encourage you, you know, to ensure that you ovulate or things like that. So there can be less invasive ways to treat infertility depending on what the cause is. If they don't work or they're not appropriate, then we look at IVF and ICSI. So that is much more invasive. That generally, although again not always, involves a lot of hormones, injections, scans, that kind of thing. What people don't realise, because as I said, there isn't a law around protecting people who are dealing with fertility. However, when you get to, so you initially have your down regs, that stops your body from ovulating, and then you have your stimulants. And so what they're trying to do, so there's one follicle a month usually that creates an egg. What we're trying to do with IVF is increase the number of follicles, get as many as possible. And there's a risk in that. There's a risk all the way through with all medical treatment, but the risk in that is over hyperstimulation, and people don't realise that worst case scenario, that can be quite fatal. So this is the degree of seriousness and importance that we need to put on IVF treatment. So, but so assuming all goes well, you have your eggs collected, you have embryos that are created, and they last day 2, 3, 4, and that's a really pressured time, getting the call every morning to see whether or not your embryo's fertilized in the first place and whether or not they make it each day. Then you have embryo transfer. Now, the moment that you have embryo transfer, and lots of patients don't realize this, lots of employers don't realize this, you are immediately covered by maternity rights. So if you choose to tell your employer, then they need to talk to you about maternity assessments. So that's something definitely, if you are being open with your employer, to talk about. Now that covers you for your 2-week wait, but what it also covers you for is if you have a positive result, obviously, but if you have a negative result, it still covers you for a further 2 weeks after your negative result. So that is something really to think about. So if you have a positive result, hopefully it will end in you holding your baby, which is amazing. Although, we must be aware that postnatal depression is unfortunately more common for people who have had fertility treatment to have their baby. Also, if you speak to anyone who has had an IVF pregnancy, it's an anxious time the whole way through. Which I'm sure it is for all pregnancies, but particularly for fertility patients. There are risks of miscarriage, there are risks of stillbirth. Hopefully, these are looked after within your maternity policies, but that's just something also to consider. If you have a failed cycle, so you have the test day and it's a negative, the employee is going to go through a period of grief. Now, this can take there's no set time to deal with grief. Just like if you lost a family member or a friend, there's no time limit on grief. So that's something to really, really kind of think about with your employee if they have had IVF, but they've had a negative result. Just to show the seriousness of this, we have done at the Fertility Network research a while ago, and it said that 90% of people said that they had felt depressive during their treatment, and 42% said that they had felt suicidal at moments. So this is the seriousness of fertility treatment. What I spoke about then very, very briefly was the fertility roadmap with the diagnosis, etc. It is not always straightforward. You might at any point not be able to take the drugs because your body just can't take them. You might not create follicles, you might not create eggs, you might get OHSS, and lots of these might mean that your treatment needs to be, stopped for the time being, and then you pick it up a month or 2 later. So this is where it's really difficult. People don't understand it's not straightforward. We don't know the dates because things are always changing. So dealing with fertility issues in the workplace, employees having treatment experience conflicting pressures on work and treatment. And it's, you want to focus on work because, you're being paid to do your job. And as I've mentioned later on, there's a financial pressure with fertility treatment. So you don't want to lose your job because that's helping you fund the treatment that you might be having. But also you don't want to risk anything with your fertility treatment because of work. So it's really, really conflicting for people. if your workplace knows and they're flexible and they're supportive, that can really, really make a difference to those pressures. So that's something that to consider when you're thinking about telling your work. Experiences vary vastly. I know that I've spoken to someone, their employer was incredibly supportive. They were really nervous about telling them and pulling back on lots of their duties. During their fertility treatment, they were promoted. And the way they felt after that was, you know, just incredibly, even more loyal to the organisation than they had been previously. I know other people who, during their fertility treatment, you know, they were made redundant, and, you know, so there's completely different experiences, and only you will know. You know, what we want to do is create an environment in all companies over the next few years where everyone can talk about it, not just in companies, everywhere, that we feel that we know that we will be supported when we are open with people. But at the moment, we're not quite there, unfortunately. So you work with your managers, you work in your organisations, really make the decision that's best for you. There are costs to the company. So if you're watching this from an HR perspective, you know, there are costs with illness, with sick, with presenteeism. So people are turning up, but they're not actually getting any work done. And I can say this now, unfortunately, towards the end of my time in my previous role, before I took time off, I knew that I was unraveling. Well, I didn't know, but looking back, I can see that. And I had miscarried at Christmas. I had had 2 frozen transfers kind of over the spring, summer. And it wasn't until the end of August, that I really realised that I had been falling apart looking back. So I had been going to work, but not working to my best ability. And that's not fair. That wasn't fair on me, because I had grief to deal with. It wasn't fair on my team. It wasn't fair on the organisation. So if I had been supported and I hadn't been open, or I had been open at that stage actually, then that might have been different. So I told my work after I've miscarried the first time, but only the HR lady. And it was because I was apprehensive about being emotional in a meeting or that kind of thing. So I just wanted someone to know. So that's how I dealt with that. I just wanted one person in the organisation to understand what I'd been through, just in case, as I say, I had been emotional, because I'd been in hospital for the miscarriage over Christmas and New Year. So they didn't know anything at all. So this is the impact. 85% of individuals said having treatment affected their work. You know, so if this is happening to you, and I've just said that it definitely happened to me, you know, you're not alone. This is normal, unfortunately. 58% reported that work affected their treatment. And if you're a fertility patient, you'll know how important your fertility treatment is. And you don't want that. You don't want to resent your work. You don't want to look back, if God forbid it doesn't work, and think that that work affected that. That is not going to be a positive outcome for anyone. So really have that in mind. 19% said that they reduced their hours or resigned. So that does happen, but then that can add to the financial pressure, either of yourself. So in my case, either to myself or to my husband, who was working and felt extra financial pressure because I wasn't. So all of these things are to be considered. And 1 in 3 men felt fertility issues had a negative impact on work. So as I said earlier, it's not just women. Employees take time off work. On average, it's 8.74 days off during a treatment cycle. Now, if you work flexibly, it might be that a lot of your appointments and your scans, you can make up the time, and that's fine. But there will be days, like i.e. egg collection and probably embryo transfer, that you will want to take the day off. People always wonder about the 2-week wait, whether they should work, whether they shouldn't. There's no right or wrong answer. It entirely depends on you and how you feel, and also the type of work you do, perhaps. But there is no right or wrong answer to that. How can you help yourself? I think that you need to realise that it is going to affect your work. It is going to affect all of you. So as much as you might try and resist and push that down, it's okay to realize that this is going to affect everything. And how you manage that will hopefully, you know, kind of mean that even though it affects everything, it doesn't have to disrupt everything. So contact the Fertility Network. I'm going to talk in a minute about the Fertility in the Workplace program that we're setting up at the moment. But contact us, speak to us, we can help. Even though this is in its infancy, so to speak, you know, we still can help. Get all the support you need, and wherever you get that from, whether it's social media, whether it is our website, you know, calling us, whether it's your friends, your family, your workplace, because you're comfortable with talking about it, make sure that you get everything that you can. Have a look. Does your workplace have a fertility policy? You know, does it exist already? Can they support you? Are they aware of the importance of infertility and fertility treatment? If they are, then that's brilliant. And there are companies out there that are. Can you reduce your hours? So, you know, I often think about it from a perspective of someone who's working at a desk. But if you work shifts, if you work in a factory, you know, there's some labor intensive jobs, you know, are there ways that you can stay in your workplace but change your role so that it's more fertility friendly? What else might they provide? So I was reading the paper this week, and there is a huge bank, a global bank, that has a maternity room. Now, is it possible that another organisation has a medication room? You know, practically speaking, when we're doing our injections, if we're doing them at work, I've been there a million times doing them, you know, in a toilet, and it's just not sanitary. It's just, you know, this is not an enjoyable process anyway. Are there ways that a workplace can help you? So with, for example, the maternity room, there's 4 separate cubicles. Is it possible that people who are having IVF can go there and have their treatment? There's the risk of them running into pregnant people if they are at work, but that's going to happen all the time. And you know, I think what we need to consider is, does the pro of using that room, which is clean, sanitary, private, for IVF treatment, outweigh the potential of running into someone who's pregnant, which is going to happen anyway, inevitably? Does your health insurance offer any support? So depending on if you have health insurance at work, do take a look at it, because sometimes it can offer you funding towards counselling or alternative therapies such as acupuncture. So definitely, if you have it, if you're lucky enough to have it, definitely have a look at that. And where possible, help Work to help you. So talk to them. I'm working with someone at the moment who is going through fertility treatment, and she is now proactively trying to, with my support or our support, the Fertility Network, to introduce a proper fertility policy. Now, if that organisation had it already, she wouldn't be having to do this side by side her own fertility treatment. So is there a way now, as a HR professional, as a manager, if you're watching this, as someone who's not going through fertility treatment, or perhaps if you are, you know that you're going to have it in the future, is there a way that we can introduce it now so that people don't have to do it when they're in the middle of their treatment? And when we talk about the fertility policies, you know, there's a whole range of things that can cover. You know, it can cover endometriosis. You know, there's lots of different things that affect your fertility that might not be the fertility treatment itself. And that's something we're working out at the Fertility Network, or hopefully if you're watching this at a later date, we will have that all sorted, so that there is reference to these kinds of things, because they really can have a huge impact on your fertility. So the Fertility in the Workplace program is something that we're developing. As I say, there is some information on our website already. So if you need it, you can go and find it there, or contact us. We will be able to send that through to you. But what we're actually doing is we're trying to create a gold standard fertility policy that we can then take to workplaces, have them take that on board, and have in their HR handbook, so that, like in the previous slide, so that when you go to look to see if there is a fertility policy, the answer is always yes. We know that people don't necessarily understand fertility treatment and all of its intricacies, unless you've been through it. And even then, there are going to be other things that you won't know. So what we want to do is introduce workshops and training so that we can take employers and managers and staff through all of the intricacies of fertility so that they have a true understanding. And that's not just going to help their colleagues and their employees, that's going to help because unfortunately, if infertility affects 1 in 6 couples, 1 in 6 people, so that's going to help with their friends or their families or their neighbours who they might come across who are going through it. Does your organisation have a health and wellbeing day? We were at one, that was another bank actually, recently. Call us, email us, introduce us to your HR teams. We can come along and speak. Do you have lunch and learn sessions or speakers corners? Whatever they're called, we can come in for a lunchtime and we can present to the whole organisation, to your HR team. We're here, we're going to create this and we want to roll it out so that all of the organisations in the UK do have a fertility policy and understand what it is to go through fertility and how to support and manage their employees who are dealing with this. Contact us. So that's our details. If you signed up to this webinar and you're watching it live, then you will have our, Megan's contact details. So don't hesitate to drop her a line or contact me and ask any questions that you want. I think the issue is that there's a lot of unknowns with fertility, which isn't great. But what we want to do, we realise that people going through it are of working age. And so if we can help support people who are in the workplace and educate and inform managers and workplaces, then that will help support us in return. You told your manager, but they didn't know what to do. And that's the thing, that's what we really want to kind of counteract. And also, a fertility policy is, you know, words on a page. It doesn't mean that people understand. You know, it's great that the information's there and we can guide people, but depending on the individual that is interpreting them, they might interpret it differently. Depending on the person that's having the kind of, you know, can be awkward conversations with you, you know, that impact will be different. So we want to kind of help as many people as possible so they do understand, so those conversations are easier. That you know, that's something we really want to do. So we've got someone here that says that they get time off for appointments, but if you need the day off or additional days off, these will be counted as sickness, and you're concerned that needing several days off will trigger your sickness policy. And so this is the, you know, so what we want to do is go into that workplace and explain the difference between going sick and needing the day off because you are having a procedure done. Now, what some people do, and these are not recommendations, these are just what some people do, and if it does get really bad, you know, these are things that you can do, is you can potentially speak to your doctor and ask them to sign you off, and they can be quite vague where that's concerned. That totally doesn't get us past the sickness policy, which we want to avoid. What we want people to realise is this isn't, although it's a disease, it's not a luxury having the IVF. You know, the treatment isn't a luxury. If it was any other disease, or you broke your ankle, or, you know, you would have the time off without question. And that's what we want to achieve, kind of a space where that is always the case. You're just changing jobs. Do you tell your new boss, and how do you approach the subject? Again, you know, like I say, it's a really, this is your workplace, this is your manager. We want to get to a situation where the answer is inevitably yes. But you will need to assess that, I think. Have you had a look to see whether or not your workplace does have a fertility policy? You can do that as soon as you get that. That might give you a bit of an idea about, you know, how they might have handled it in the past. So perhaps have a look at that. Yes, Fertility Network will come to your workplace. If you want to drop Megan a line, we'll see if we can get that arranged and how quickly we can get that arranged. How would you suggest bringing the subject up with a manager as it feels like a hidden subject? You're absolutely right. What I would say is that the question, how would you bring it up? You can perhaps find someone in your organisation who's been open about it before, you know, and often we find, and I think we find this kind of in general, people will talk about it after they've had their baby, rather than during or before. And that's entirely their prerogative, although, you know, we want it to be so that people can talk about it during as well. But perhaps find a champion. Someone that I was talking to the other day, who had gone through quite a difficult kind of, you know, working environment. They realised that their manager's manager had gone through IVF, and so they understood. So possibly finding, a champion, someone who's been through, someone who understands, someone who isn't asking for the time off, because I think that's one of the pressures. We're talking about it and then we're asking for the time off, but not being specific. So it just makes it a really uncomfortable conversation. Whereas if you can find a buddy, and that's another thing that we will definitely look at in the future, if you can find like a fertility buddy in your workplace, perhaps they can have some of the awkward conversations with, whether it be your HR or your manager. That's something you could certainly try to have a look at. You were signed off for the 2-week wait. From what you said, is it necessary to have a note? My understanding is that you would need a doctor's note, but they don't need to be specific. You could take it as holiday. I know that one of mine, I took it as holiday. It was difficult doing it like that because I didn't know which weeks I wanted. So that's kind of a bit risky, but that's something to think about as well. Like, the point is that we want the leave, you know, but realistically workplaces are not going to necessarily let you have all of it, because we don't know how many rounds of treatment we might have in a set year, which is usually what the sickness and annual leave is. But so it might come to the point where you've used your sickness or you've used your fertility, and so you might have to use your annual leave. You know, I'm not saying that's right, but that, you know, that can be the case. Do you think this will lead to a statutory right for time off fertility treatment? One day, perhaps, but that's not what we're working on at the moment. But it would be really interesting to see where this goes. And I don't think that would be a bad idea at all, but that isn't, you know, fertility treatment is such a taboo at the moment. So what we need to do is educate and support people, and maybe we will need that, but maybe we wouldn't even necessarily need it because the understanding would be there. But I wouldn't rule it out. Someone's told their line manager but not colleagues. You just wondered what your advice was about being open with everyone. Again, that's entirely at your discretion. You know, one of the reasons for it is that they will support you, I'm sure, with any work that you might have to miss, or, you know, if you've got difficult presentations, that kind of thing. One of the thoughts that I had was that I didn't want everyone to be saying, did it work? So, but you can be vague around the treatment as well, you know, so they don't know specifically. Another thing actually that makes me think of is, if you have treatment and you've had time off, if people ask you whether or not you're pregnant, you do not need to tell them. So if you become pregnant naturally or through IVF, you have until week 15, I believe it is, to tell your workplace. It's exactly the same if you've had IVF. You do not need to tell people that it has worked, and equally you do not need to tell people that it hasn't worked. So if people ask you that, I would suggest that is inappropriate and that you should speak to your HR team if you feel that that's what you want to do. But yeah, so there should be no pressure. You do not need to tell anyone. Being a teacher is a really difficult thing when it comes to IVF. And I know that, you know, you have set holiday. I know how difficult it is to get time off around that. That is a really difficult thing. I know that clinics are conscious of people who are teachers. So it's working with your clinic and kind of arranging things as early as possible. If you can take a bit of time off so you can have some of your meetings, you know, your kind of prep meetings, etc., earlier. But yeah, I totally accept. And that is a reason that, you know, a fertility in policy in the workplace, in schools, is really important. have been into workplaces where over a quarter of people have come along to the talks at lunchtime. So that's a significant amount of people. And actually what we found in some is people are really open when they're in that room, that they might not have realised. And just by advertising it, just by having a poster in the toilets or having the poster in the kitchen to say this is happening, that has an impact on people. Whether they come to the session or not, that has a positive impact. And we know that because we received feedback from an organisation that we went into that they couldn't make the session because they weren't in that day, but they had seen it and it really helped them. They felt much more supported because they knew that their workplace was having someone from Fertility Network in to talk, so people would understand it more. So it really is very positive. So important to inform the workplace, and really, you know, as long as you don't think it's going to have a negative impact on you, it really is. Can you talk about any of the negatives of speaking to your workplace? There shouldn't be any, is the truth, because, you know, if we go into the, you know, there shouldn't be any. Unfortunately, that's something we can't control. From my perspective, I wasn't concerned about promotions or anything at that stage, or kind of getting new projects or anything like that. But I know that people certainly do have those concerns sometimes, which they shouldn't need to, but I know that some people do, and that's why they're nervous about telling work. As I said, for me, it was more that I didn't want people saying, has it worked? You know, that kind of thing. So there are lots of different reasons and lots of different things that people would perceive as negatives around telling the workplace. But there are so many positives. Should be a statutory right. Yeah, that's something we will definitely start looking at once we get this up and running. You're an employer as well as someone having been through fertility treatment. You don't have a fertility policy, but you'd like you to. You do understand, and often you'll find that's the case. You know, whether there's a policy or not, it does depend on people's experiences. It's the same with anything. But yeah, absolutely, give us a call or an email, and we'll see whether or not we can work with you to get that sorted. Well, not whether or not, but when we can work with you to get it sorted. When you told your manager, he asked you a few weeks after if you thought of who your maternity cover would be. You haven't told him again, and that is the risk. Very insensitive comments, and that, you know, that manager shouldn't be making comments like that to anyone, and it does put a pressure on you, you know, as well, because you don't know if it's going to work, and you don't want to be thinking that far ahead necessarily. Often when you're going through fertility treatment, you just want to take each day as it comes. So yeah, so that's very inappropriate. If there's anything that you think is inappropriate, if you have spoken to your manager, then make sure, you know, have that conversation with your HR department, definitely. You think the assumption at your work is that NHS covers treatments and do not quite understand what a toil this has on employees, especially those in same-sex couples. Absolutely. Sorry, I just had an email pop up then. Not that my emails are open, but that was my distraction. I think that you're right. I think that people don't think about the financial implications, and there are some places in England in particular where there's no funding at all. What would an ideal policy look like? That's really interesting, and that's what we're working at the moment. So we have sent lots of recommendations over to, we've got a committee of HR experts who are looking at that policy for us. We want to take into consideration that people on average take 8.74 days off, or round it up to 9 days off for treatment. We need to consider how many treatments potentially people could have within a year, and how that could be split. I don't know, you know, what that will look like once it's finished, but we do hope in the next few weeks to have that confirmed, and that would be the gold standard. And it will be per cycle, hopefully, rather than per year.
I think there's a common misconception around success rates with fertility treatment. Would your workshops cover this? I think that this would help educate organisations and help maybe avoid some of the clumsy questions.
Yeah, okay. You can make yourselves anonymous if you want to. I think you're absolutely right. Workplaces and everyone thinks that if you're referred and you're having IVF, that bang, it's going to work. And that is a massive, misconception. So we would definitely talk about success rates and the fact that on average it's kind of a third of treatments work, which means that 2/3 of treatment don't. So yeah, we would absolutely include that within the information. In regards to your campaign, could you also raise how discriminatory it is not, it is to not have allowed one round if partner has we are, there's so much that we need to campaign on. We can't cover everything in all of our campaigns, but that is something that we are very aware of, and we will campaign on. If not this time, then it is something that we are, as I say, very aware of and always campaign against. How can you help us? That's a really, really interesting question. Thank you so much. So contact us, well, speak to your HR department or have a look and see if you've got fertility policies. This is, at the moment, we're the 22nd of August 2018. This is a work in progress. This is something that we have information on. So if you need it, then contact us. We can support you. But it is something we are honing and getting kind of completed at the moment. But if you prime your HR department, if you know whether or not you've got a fertility policy, you can contact us and we can come into your workplace. Obviously, we're quite a small team, but we will hope to get volunteers who perhaps will do it. We can train you, we can give you the presentations. Perhaps you're comfortable doing it in your workplace, or someone that could come in and talk. So we're looking for volunteers all the time. But yeah, contact us. We want this to go out to all companies. So if you work somewhere and that doesn't have a good comprehensive fertility policy, or you feel like the employers, managers and your colleagues don't understand, then we will be able to come in, if not immediately, later down the line once we have our workshops and training and actually kind of facilitate that education. So yeah, have a look. Do you have a policy? And if not, or if it's no good, or there isn't everything else, then contact us. Understand that like I said, we are a small team, so volunteer to do this perhaps in your own workplace. There's lots that you can do. And if you have ideas, then do let us know. So someone said here, from your experience, fertility treatments and telling work colleagues, mostly very positive support, but also some negative and sensitive comments as people generally don't understand or don't know what to say. Awareness of what's involved is good, and that is a general comment across the UK, in a workplace, as a family member, as a neighbour. People don't understand infertility and they don't understand fertility treatment, and so the more that we can educate people, the more that we can break the taboo, the more that we can talk about it, hopefully less and less of those insensitive comments will actually happen. You work for a small business, so only 10 employees, so it's not covered by a policy. You don't have a HR department, so it's not easy. That is a difficult situation. Do they outsource their HR? Another thing that we are looking at in all of this is often as part of your workplace kind of benefits, it is an organisation that supports the HR. So I think one of the other brands are available would be Access. So they provide a support line that you can call, and sometimes it's to do with your health insurance, but I have known of organisations that you have that health line or that call line even if you don't have health insurance, but they can help refer you. So see who manages. Someone must manage some HR somewhere along the lines, because there's pensions, there's recruitment, so they must have some contact with someone who is an HR professional, and see whether or not that can happen. Something else that we do at Fertility Network is we have a fundraiser, and that's another thing you can do to help, and it could be a really good thing to have in a workplace. So there's something called a fertility. and you can print off a quiz as part of that fertility pack. And if you think about it, like it's a coffee morning, but what the quiz is it's an acronym quiz, and it's really difficult sometimes for people who don't understand fertility, have no experience of it. They don't know what to ask, and so what the acronym quiz is lots of the acronyms that many of us will know, like FSH or EC for egg collection, that kind of thing. But it's a quiz, so it's fun, and it means that if they don't know what it is, they need to ask. And if you say something like egg collection, hopefully because of the environment that we're in, and it is a fertility, this is an open forum, then the next question, if they don't know, will be, what is an egg collection? And it just prompts people to ask questions, especially for people who don't know. So that might be something, if you felt comfortable in that small business, but this can be done on a grander scale as well, perhaps to have something like that. If you are open enough, or you can, encourage, perhaps if you've got, a close friend working with you, you could ask them to put it out as an idea. That would be amazing. Another thing where that's concerned, and going back to the how can you help us, charity of the years, if we can talk to your HR departments and look at that, what that does is it gets Fertility Network in front of all the employees if you're all fundraising for Fertility Network during that year, which breaks the taboo. People are automatically going to be talking about it because that's what you're fundraising for. So it just makes that conversation much easier, and it's not putting the pressure on you to talk about it. It's because everyone's finding out about it. Everyone is fundraising for it. So it just makes it a much more open conversation. So that is another way that you can help, actually. And that's why we think it's so important that we have the workshops and training, because you can write all the letters down on a page, like I say, and even, I went through, a fertility roadmap. It's not until you're in it or are close to someone that is that you realise how changeable it is and how different it can be. Each round, the same person every round can be different. And that's why we want to do the workplaces and the training. Absolutely. The clinic you went to provided leaflets for patients to hand to family and friends. So we do have that on our website as well. So perhaps, Megan, we can put that on the link as well. We have many fact sheets. And that is one that, you could definitely hand that to your employer. That's an excellent idea. Okay, I think that's it for now then. Thank you so much to everyone who has attended. Thank you if you're watching from an HR or a managerial perspective. We really appreciate you watching this, and do get in touch, whether you're an employee or a manager, and talk to us. We can help. We're a small team, we're growing. This is a work in progress at the moment, but we can still support you even though we don't have the completed package at the moment. There's just one more, I think. We'll call it a day. Training package sounds great. Thank you. Your workplace is relatively liberal, but there is zero awareness of infertility, which is, the problem that we're all facing all over. Definitely. It's an invisible problem. You're right. And so therefore lots of unintentionally insensitive comments. Absolutely. There are easy things that HR teams could do at no cost, e.g. an infertility awareness day. Absolutely. And the fertility could be part of that, and notifying staff beforehand when someone's going through it. What's crucial with that is privacy and confidentiality. So only if they have permission from the person. The other thing that crossed my mind a minute ago, which has just come back to me, and after this I will wrap this up, is that being childless in a workplace, the fertility policy is, we also want to cover that. So whether you are having your fertility treatment, or whether you, as a result of unsuccessful treatment, and you decide not to go down alternative routes to having children, then you will end up childless in a workplace. And that's another area that we really want to support. And that can be as simple as people bring their babies into work, because, during their maternity leave, because these are your friends, these are your colleagues, you want to show them your baby. But what can be done is an email can be sent, so that people know when that person is coming in. And then we want the understanding to be such that if someone doesn't want to be in the office, there is an opportunity for them to work from an alternative office, work from home, go out for an hour, you know, take an alternative lunchtime break. So it's not just a fertility treatment. This is about children in the workplace generally. We don't want to alienate anyone who has got children, of course, but we want to make sure that there is protection and support for people that don't. So that will be part of the fertility policies also. Okay, I think that we're done then. Okay, thank you so much for watching. Please do get in touch with myself or Megan, and we'll make sure that we put those links on the email. If you are watching this live, you will receive that, but otherwise do contact us. Okay?
Yeah.
Right. Thank you so much, everyone. Take care.